Hello, I'm Alicia Nye, Associate Dean for Nursing. I am here to present a short COVID 19 training video. The current pandemic has increased our awareness for infection prevention practices that help stop the spread and protect the public. There are three main objectives I'd like to accomplish in this training video. Describe the protective safety measures in place on campus, understand how to apply social distancing parameters while on campus, and to describe effective infection prevention practices to be utilized while on campus. How is the virus spread? The virus is thought to spread mainly from person to person, between people who are in close contact with one another, through respiratory droplets produced when an infected person, like the person in this picture, coughs, sneezes, or talks. Also, COVID 19 may be spread by people who show no symptoms at all. How easily a virus is spread from person to person can vary. The virus that causes COVID 19 is spread very easily and sustainably between people. The best way to prevent illness is to avoid being exposed to the virus. Currently, there is no vaccine to prevent COVID 19. Until a vaccine is made available, the best way to prevent illness is to avoid being exposed to the virus. Do not gather in large groups, maintaining social distancing in workplaces, classrooms, hallways, etc. Wash your hands often with soap and water, especially if you've been in a public place, and avoid touching eyes, nose, and mouth with unwashable hands, and coughing and sneezing by covering your mouth and then doing good hand hygiene are very important. So let's talk about the pre-entry before you're coming on campus. Prior to coming on campus, an online screening form will need to be completed right before you're ready to leave the house to come on campus. The screening form asks questions surrounding the COVID 19 risk, where you will be on campus, and updated contact information. If you're a student coming to campus, there will be entry points and exit points identified that prevents exposure to high-risk areas that naturally congregate people, like elevators. Upon entry, you'll have temperature checks and a validation that you have completed that screening form as well. Personal protective equipment is used as a barrier to protect you from specific chemicals and exposures to lab material, working with others who may be infected if you're a healthcare worker, and following the guidelines by faculty if you're a student and using this personal protective equipment. In general, masks and gloves will be used more routinely than ever before. Masks will be used if you are coming on campus, and gloves for cleaning and disinfecting or working with other material that is potentially hazardous. Let's talk about face masks. There's a right way to wear a face mask and a wrong way to wear a face mask. When using a face mask, the mouth and the nose are fully covered. The covering fits tightly against the sides of the face, so there are no gaps. You should not anyway, have any trouble breathing when wearing the mask. Avoid touching the face as much as possible. Keep the covering clean. Clean hands with soap and water or hand sanitizer before you place the mask and after you remove the masks. Cloth masks should be cleaned daily. How to remove the mask properly? That's a good question. First, you want to untie the strings behind your ears or stretch the ear loops, because some masks do have the ear loops. Handle only by ear loops and ties when you're taking off. Fold the outside corner together and discard if it's a disposable mask, and then wash your hands afterwards, or launder the mask that's washable daily. Also, you can see from this picture, there is a right way, and you can see how it fits over the nose and the mouth, and a wrong way. You want to avoid the wrong way, and you want to wash your hands immediately after. There's also respiratory etiquette I want to talk about. If you have to sneeze and you're not wearing a face mask, it's always important to use a tissue to cover your mouth when you're sneezing or coughing. Or the crook of your elbow you want to use when you're coughing or sneezing, to avoid using your hand, because you could infect someone with germs that way. Hand hygiene practices are important. Hand sanitizer that contains at least 60% of alcohol will be available on campus, at classrooms, and various work settings. Cover all surfaces of your hands and rub them together with the gel until it is dry. And avoid touching your eyes, nose, and mouth with unwashed hands. You need to wash your hands with soap and water for at least 20 seconds with warm water. And then don't use your hand to turn off the water. Make sure that you're using a paper towel so you don't reinfect your washed hands. There are high-risk areas, and we're going to be redirecting students outside of those areas with various signs, as you can see in this picture, so that way students know directly where they need to go to get to their classrooms. Social distancing, I mentioned before, is very important, 6 feet apart. If you're in a workspace, you need to make sure and ensure that there are 6 feet between you and another person. And if there's any way that you need to get up and walk around hallways, you need to wear your mask so you're not exposing yourself or others to this virus. There will also be sanitation, cleaning, and disinfecting solutions available. We want to clean and disinfect frequently touched surface areas. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards. Facilities has disinfectants that has been distributed to workspaces, classrooms throughout the campus. If you do not see these products as depicted in the video, you can reach out to facilities to get either a resupply or more of a supply. Please remember, if you're using these disinfectants, to use gloves when you're wiping surfaces clean. So gloves is an important part, and when to use gloves is mainly when you're using the disinfectants or you're touching particular things that, if you're a student or faculty, has deemed worthy that you need to wear gloves. Using gloves properly is important. Proper removal of gloves, I'm going to go over that now. First, you need to grasp the outside of one glove at the wrist and do not touch your bare skin as depicted in this picture. Second, you're going to peel away from your body, pulling it inside out. Third, you're going to hold the glove you just removed in your gloved hand. Fourth, you're going to peel off the second glove by putting your fingers inside the glove at the top of your wrist. This is to avoid reinfecting yourself with anything you got on your gloves. And then fifth, turn the second glove inside out while pulling it away from your body, leaving the first glove inside the second. You're going to dispose of the gloves safely and do not reuse the gloves. And then lastly, you're going to clean your hands after removing gloves either way. Stopping the spread is everyone's responsibility. There are some key points out of this video that, if anything, you take a common sense approach to when you come back on campus. Stay six feet apart from one another, and if you're unable to stay 6 feet apart, then use a face mask and use it appropriately, covering your nose and your mouth. Cover your cough and your sneezing with a tissue and wash your hands afterwards. Don't touch your eyes, nose, or mouth where viruses can easily be spread. And keep those surfaces clean and disinfect them frequently, especially those high touch point areas like your keyboard, your mouse, the door handles, any of those surfaces that you know are high touch areas. Also, stay at home when you're sick. We don't want you coming to campus and spreading any germs. And making sure that you're washing your hands frequently, in particular if you've been in public places, or using that hand sanitizer.